handle supplements is a very important thing. And I'm frequently asked questions about this supplement and that supplement. Should I be taking it? Should I not be taking it? In fact, 40 to 60% of the American public regularly takes supplements, and if you have a chronic condition, it's even higher. So there's several things that I tell my patients that they need to know when they engage in supplements. Number one, the quality of supplement regulation, at least in the United States, is not very good. So if they're simply, going to a store and buying a supplement off the shelf, they may not be getting a good supplement. In fact, there may be some things in the supplement that they don't want to get, or they may not even be getting what they think they're paying for in those areas. So you have to pay attention to what is high quality and make sure you only buy high quality supplements. The second thing is that supplements don't replace nutrition from the diet. Multiple studies have shown that if you simply isolate a vitamin, for example, out of the diet and then try to take it like a drug, it doesn't work. But it does work if you get it in the diet. So first, make sure you have a healthy diet and don't try to substitute a poor diet with supplements. And then third, most doctors don't know much about supplements, so you may have to educate them or you may have to point them to guides like the one I have on my website so they can learn about it, to be proactive about talking to them about supplements. Make sure you remember that being engaged in your own health care is probably more important than the supplement you're actually taking in those areas. So be engaged, keep proactive, ask your doctor to work with you on appropriately managing supplements. So there's three things that you need to know about in order to properly manage your own supplements. Number one, you need to be aware of depletion. Number two, you need to be aware that they interact or can interact with medications. And number three, you need to be aware that some of them may be useful for treatment if they're properly used. So let's go through those one at a time. First of all, depletion. Depletion usually comes from poor intake in the diet. So number one, make sure you get a good diet. About 10 to 15% of people are low in vitamin B12, especially as they get older. Other areas that are consistently low in intake on surveys are magnesium, zinc, and folate, especially if you're pregnant or thinking about getting pregnant. So first of all, make sure you get enough. If you're in a category of low intake, perhaps you can ask your doctor to measure to see if you've got a deficiency in those areas. So the second area where you have to pay attention to depletion is the possibility that a medication that you're on might be depleting a nutritional area and needs to be supplemented. For example, if you're taking sedatives or anticonvulsants like lorazepam, it can deplete things like magnesium, already a thing that's often low in the diet. The second commonly used medication that can deplete nutrients are antacids. Things like Pepcid or Zantac are common names. Those things can deplete B12, magnesium, zinc, and other areas commonly low in the diet. The final one that's very common is the use of statins. Those are drugs to lower lipids and cholesterol in your blood, and they routinely deplete a nutrient called coenzyme Q. And so if you're on a statin, especially high dose, you should be supplementing with coenzyme Q. So the second area to pay attention to is interactions with medications that you're on. Many drugs interact with nutrients, and so if you're on a medication and are also taking a nutrient, you need to talk to your doctor about that to make sure it doesn't happen in a negative way. The most common one is blood thinners. So warfarin is often used and interacts with many things, especially vitamin K and melatonin in those areas. A second commonly used supplement that can interact with medication is fish oil supplements. High-dose fish oil can interact with oral contraceptives and weight loss drugs such as orlistat, and so you should talk to your doctor about that. Finally, and most importantly, a commonly used supplement for mood disorders is St. John's wort. It interacts with an enzyme in your liver that then metabolizes a lot of different kinds of drugs, lowering those levels in your blood. And so if you're going to go on St. John's wort, then make sure you pay attention to the list of possible interactions that can occur and talk to your pharmacist or your doctor about that.